happy to introduce our speaker today. Logan Morse has a doctorate in pharmacy from Ferris State University or College of Pharmacy. He practices functional integrative medicine, is dual board certified in anti-aging and functional medicine. He is director of special projects at Keystone Compounding Pharmacy and serves in the U.S. Air National Guard. Thank you for your service.
Thank you.
Anyway, he's going to talk today on optimizing aging, the role of supplements in promoting health. Thank you all for being here. Thank you, Logan.
Thank you for that introduction. I appreciate that. Like Susan said, my name is Logan Morse. Today, we're going to be talking about optimizing aging in the role of supplementation. And so we're not going to be diving into every single supplement that's out there. I wish I had the time to do that, but I don't want to bore you guys too much today. So like Susan said, I did graduate from Ferris State University. I'm the director of special products at Keystone Compounding Pharmacy in Grand Rapids, Michigan. Just a fancy title that says I wear a lot of different hats between marketing and seeing patients in the pharmacy for hormone replacement therapy, as well as chronic conditions, things like adrenal dysfunction, migraines, things of that nature. I do work for the Indiana Air National Guard. So that's kind of a pretty cool unit. We oversee biochemical, radiological, and nuclear warfare. And so if something were to happen within the Midwest, that's who would be called. I do some consulting on the side, and then I am founder of Vital Sprouts, which is a nonprofit organization that provides supplementation to children in need who don't have access to supplements to kind of help out with their health. As just a quick disclosure, I do work for Keystone Compounding Pharmacy. So objectives today is to understand the relationship between aging and supplementation, as well as navigating these choices, the dosages, and some potential interactions, and developing a natural approach for longevity. So let's be honest with ourselves. We're not getting any younger. I am reminded of this every single day with my children. Every single time I wake up, I'm like, wow, why does my shoulder hurt? Why does my back hurt? Why are my knees sore? In fact, I was playing soccer with my son the other day, and I woke up and I was like, wow, oh my gosh, like, how did he beat me up so bad? And so it is something that we are concerned about, especially as we move in from ages 30 and up. So if you've experienced some of the symptoms of aging, things like insomnia, being sick, hard of hearing, having bad memory, losing muscle, fatigue, chronic pain, or if your organ systems feel like they're just not working as well, typically it's like, hey, I feel like I have to breathe a little bit harder, or hey, like I'm having a lot more indigestion, gas, bloating. If you've had some of those symptoms, unfortunately, you're going through aging process. We also see a 10 of a increase in the medications, and that's according to the National Institute of Health. So as we age, medications increase. Sometimes this can be good and helpful, but other times it can be detrimental because as we increase medications, we increase nutrient deficiencies. So medications can be really beneficial. They can be life-saving for some individuals, but every medication that we take does deplete the body of a nutrient. So for example, a medication called metformin that's used for diabetes depletes the body of B vitamins, and B vitamins are very important for the production of energy. Other medications like birth control also depletes the body of B vitamins. And there's actually a correlation between B vitamins and developing anxiety and depression. So now we're seeing more and more females in their early 20s who have anxiety and depression. Well, why is that? Well, that's because more females are started on birth control at a younger age. And they're not supplementing with B vitamins because our current diet system isn't promoting a healthy and robust diet. So a lot of issues there within nutrient deficiencies. And so how is aging influenced? Well, it's influenced by our sex, our genetics, our socioeconomic status, as well as our lifestyle. So a lot of times, right, who is impacted by this the most? Well, unfortunately, typically females are impacted the most. That's because of the menstrual cycle and the loss of a lot of nutrients that way. Individuals, right, who can't afford to have really good, robust, diverse diets right? That's a big issue. And then lifestyle. So individuals who are exposed to chemicals, whether it's environmental or even dietary chemicals, can be an issue. So this can vary person to person. So depending once again on your genetics, it's going to vary. And they're typically as we age, it's almost phases, right? So in our 20s, we start to notice that our skin as well as our hair starts to change. My hair, I started getting gray hair when I was in like 26, right? So we start to see those. Our hormones start to decline in our 30s. That's why I almost always recommend young females and males when they're between 25 and 30 to get their hormones tested. And the reason why you do that is so that way, if you ever need to replace your hormones later on in life, you have an idea of your baseline when you felt generally the best. Because if I said, hey, who wants to feel like they were 25 again? I would assume a majority of you say, yep, sign me up. I'll take that energy back. Organ systems begin working less efficiently in our 30s. And then our immune system significantly declines in our 60s. And one of the topics that we're going to be talking about a little bit today is sustenance. And this is when our cells no longer divide or grow. And what can happen is when you get a cell that said, hey, I'm done doing this, if the body does not destroy that cell, it will start to create inflammation within the body. And that inflammation then causes damage. It causes organ systems not to work as well. And so this is a big issue within our bodies. And so as we age, organ function decreases. So if you had to guess what organ plays an essential role in aging, would you say, I guess, show me a raise of hands. Would you say it's the brain? Is that the most essential? What about the heart? Who thinks that's the most essential organ? Liver? But I would argue it's the intestinal system. And here's why. So as we age, we are going to be decreasing the nutrients that we can absorb. And the organ that's the most important for absorbing nutrients is our small intestine. And so that's where almost all of our nutrients are absorbed, especially things like vitamin B, as well as the production of serotonin, which helps with our mood. And so the system here, and I know individuals online can't see this, right? You have these little villi, which are, you can almost think about arms. And these arms help increase the surface area of where we can absorb things like nutrients and chemicals and things of that nature. And so our body is really sophisticated and it says, cool, we'll make a bunch of these. And it creates this huge network of areas where you can absorb these particles. And so it's very important that we keep our intestinal system healthy. But there are things that can impact that, medications, any medical or psychological conditions. So if you're underneath a lot of stress, guess what? Typically, your GI system isn't working as well. You'll typically have diarrhea. You'll typically have gas and bloating. You may even notice that you will cycle between diarrhea and constipation. And then other things like social issues, like poverty, can cause a big issue in the GI absorption. The intestinal system is very important, and there's a lot of conditions now that we're realizing stem from the GI system. It's almost kind of like our second brain in a way. And so the way that the intestinal system is set up is you have this microbiota. So this is, if you've ever heard of probiotics, right? This is where we're saying, hey, you should take probiotics because it's good for your gut health. Well, here's why, is it's protecting, it's that top layer that's protecting the GI system from toxins, from viruses, parasites, things of those nature. Next up, you've got a chemical barrier, which is made of mucin. You can kind of think about this like mucus. So you've got a mucus membrane that sits there and says, hey, we don't want things penetrating and getting into our system. Because what happens is on this other side down here, which isn't shown, is you've got blood. And if you get chemicals or toxins or viruses or parasites that then get into the blood, where does it go? Well, it goes everywhere because your blood goes everywhere. So then you'll have a lot of issues there. Your skin lining in the intestinal system here is 1 cell thick. So as you can imagine, it's very, very thin. And so things can get in to our blood very easy. And what's important for this is that there are tight junctions, and these junctions essentially keep the body from opening up too much. Think about like a cheesecloth. If you take a cheesecloth and you really stretch it, well, now everything's going through it, and that's not what you want. You want to make sure that you're blocking things from getting through, so that way you can separate your product, right? And so there's a condition called leaky gut syndrome. Now, depending on your practice, some people believe in this, other people don't. And that's why it's called a syndrome and not a true condition. But leaky gut syndrome, I do see this quite a bit in my practice. And there's a disruption in the epithelium that causes an opening in those tight gap junctions that I was talking about. And so as you can see, the breakdown here, this is what a healthy system would look like. Here, you're going to get what's called dysbiosis, which is where the microbiota is now influenced. There's less good species versus bad species. There could be a whole presentation on probiotics, but I won't go too in depth there. As those species get broken down, or you get more bad species than good species, you'll get a lot of those symptoms. And then you move into leaky gut syndrome, where the body is being attacked, and you start to get a lot of inflammation. It can also lead to conditions like autoimmune, things like multiple sclerosis, rheumatoid arthritis, celiac disease, type 1 diabetes. These can all be attributed to leaky gut. And a lot of causes is just one, the way we eat. We eat a lot of foods that are high in gluten. We eat a lot of foods that are high in dairy. Don't get me wrong, not all gluten and dairy is bad. You can eat it. It's just the amounts that we eat. So for example, I know my son's 5. He has a lot of friends that survive off dino nuggets and milk, and that's all they eat. And so there's a lot of issues with doing that. You deplete the body of magnesium, for example. And so our diet is really impacting a lot of our health. So I'm going to keep foot stomping on the GI system here for a little bit longer. As we age, there's a decrease in the nerve function in the myenteric plexus, which is essentially what controls GI movement. If you've ever had constipation, that means your plexus isn't working, because what happens is the little arms there, the villi, help push the food down, and then there's a contraction within the intestinal lining. And as you lose those villi due to aging, now you have less surface area, so you're not going to absorb nutrients as well. And because of that, then you get an increased risk of infections and the severity of those infections. So a damaged or aging gut is going to lead to more nutrient deficiencies. So that's why over half of US adults will take dietary supplements. So what supplements actually support the body's aging? So we're going to look at 4 different supplements today, kind of go a little bit in depth about them, how you should be looking at them to make sure that they're right for you. And so hopefully after today's lecture, you guys will be a little bit more informed about how you should be selecting supplements. The first is curcumin, which comes from turmeric. Curcumin is just one of the active components to turmeric. There are actually several. There's 12 active components. Now, curcumin is not well absorbed in the gut. So if you are looking at a product and it just says curcumin, and there's no, and I'll talk about this here in a little bit, there's no ways for it to be improved in absorption, you're essentially paying for a very expensive urine and stool. And so curcumin is poorly absorbed. It is rapidly metabolized by the liver. So with curcumin specifically, you get this big absorption and then a big drop off. So you may feel better for about an hour, 2 hours, and then all of a sudden you're like, wow, I feel like crap again. Like, why is my back hurt? Or why is my knee hurt? Or why am I having all this inflammation? How do we increase the absorption? We use components like black pepper. So piperine is a raw material that is used for increased absorption. You can use nanoemulsions or liposomal forms. These are fats because our GI system likes fats. So if you've ever gone outside in the rain, right? When it rains, the water hits you and it rolls off your skin. But if you drop a little bit of oil on your skin, it's really hard to get it off, right? And that's why we have to use soaps to clean it off that pick up that that oil off of our skin, while our GI is the same way. It likes fat and it will absorb it much easier. So if we add a fat component to it, it'll get better absorbed. Now with curcumin, you can dose it very high. So up to 12 grams was studied, and there was no significant side effects from that. And typically dosing, I would recommend between 500 to 2000 milligrams a day, depending on the condition. So some benefits to curcumin. I really want to foot stop inflammation. Because we know that inflammation is so important in the aging process, we want to get it down. And there are so many exposures to inflammatory mediators today that it's really hard to kind of avoid. So for example, my father-in-law works or had worked for a insect company. And so I won't name which one, but he was exposed to a lot of pesticides. Well, what do you know? He has a lot of health conditions because those pesticides get into the body and they create a lot of inflammatory issues. And so we want to make sure that we're reducing inflammation as much as we can. Now that impacts our cells from how they divide, how they migrate, how we kill them within the body, right? Because we don't want a cell living forever, because we talked about earlier how that creates inflammation when it does no longer divides, as well as can impact wound healing. So you can take some turmeric powder, just you go to Sam's Club or Costco or wherever you want to go. You can take that powder and you can mix it with a little bit of oil, or even like I like Vaseline, and mix it with a little bit of Vaseline, and you can apply it to a wound, around the wound, and that can be very beneficial. Psoriasis, you can do topical turmeric with psoriasis, and that can be beneficial for some patients. Now you do have to be careful if you are doing that, because it causes the skin to turn orange. So you don't want to be walking around like an Oompa Loompa because you're applying turmeric all over your body. Some additional benefits, it can help with memory, right? It can postpone aging, and then also help out with conditions like atherosclerosis, rheumatoid arthritis, as well as many others. So how does curcumin impact aging? Well, they took, let me step back here real quick. When we do aging studies, we are typically looking at fruit flies, nematodes, and mice. Those are going to be the three most common models that we look at. The reason why are fruit flies and nematodes, they reproduce very quickly, and they also have shortened life cycles. And so if you increase, let's say, a nematode that used to live at 7 days, and then also now they're living at 14 days, you can say, oh, wow, well, we definitely are increasing the aging process. It's not aging as quickly, and then we're improving that. So the theory with curcumin, and you'll find out this with a lot of different medications as well as supplements, is sometimes they don't really know how it works. There's like, well, this is how we think it works, but we're not really sure. And so their theory is that because curcumin decreases oxidative stress, which is an inflammation process, it downregulates what's called MAPK signaling pathway. So it's a inflammatory pathway that it's working on. In the clinical trials, they were shown that it did reduce symptoms of age-related diseases. Once again, atherosclerosis, diabetes, even cancer. So it reduces the cell number and inhibits it from metastasizing. Now, I will say that I would not, I would follow up with your primary care provider if you are deciding to use turmeric for its cancer benefits. Please talk to them first before you just treat yourself. It does increase the level of sirtuins in the AMPK pathway. So sirtuins are another pathway that help out with inflammation. So once again, I'm going to really foot stomp on inflammation being an issue. It is neuroprotective and does have anti-tumor properties. So this is another graphic on cell sustenance. And so what can happen is your body is exposed to stress. You have a normal cell. The cell becomes stressed. It stops replicating. It becomes a sustenance cell. It produces some proteins here. Those proteins then decrease the ability for the body to get rid of those sustenance cells. And then they start accumulating. This causes chronic inflammation and then increases those proteins from being made. So now you're just going through this cycle. And so as you can imagine, if you build and build and build more inflammation, you're going to have more issues. This is a really great graphic on the sirtuins and reducing inflammation. Curcumin does provide some caloric restrictions. So because of the way it's getting absorbed in the gut, it can help with that. It reduces inflammation and it can diversify the microbiome that's in your gut. And so the microbiome is very important. The reason why we say that is things like serotonin. 95% of serotonin is made in your gut. If I were to probably ask you to raise your hands, who knows somebody with anxiety or depression? Probably most of you would say, yep, I know somebody, or even myself, I've got that. That could be an issue with the gut. And so this pathway here, you'll see curcumin if you eat it, right? It's going to mimic a lot of these pathways. It affects things like mTOR that causes the body to inhibit autophagy. And that's going to lead to, right, aging here. Here we see the microbiota's impact, which is going to help out with aging. Here we see it's blocking cancer. So a lot of great benefits with turmeric. So I wanted to go a little bit more in depth on the differences between what we see in the fruit flies and nematodes versus mice and rats. So when they looked at the studies and they completed them, in the fruit fly and nematode population, they found that it actually increased fertility and reproduction. So there's a potential that by taking turmeric, it can help out with fertility. It does, once again, delay the expression of aging. And it can improve learning and memory. And it does this by reducing the amyloid plaque formation, which is typically seen in Alzheimer's disease. And so once again, that is a inflammatory pathway that generally occurs through that. In mice and rats, once again, we see a reduction in inflammation. We see improved fertility again. So once again, kind of not something that you'd say, hey, I'm going to go to the store and get turmeric so I can improve my fertility. So very interesting. There's no studies in humans that prove that right now, but just something to be aware of. It does improve cognitive ability in mice and rats. So they took rats, they gave them turmeric, they put them in a maze essentially and said, how quickly do they get to that project? Normally it's cheese or something like that. And they saw it increase times. They changed the patterns and they were able to figure it out faster than mice that were not taking turmeric. And then they did notice that the high doses did trigger cell sustenance, so it was able to get rid of those cells and improve cancer. So how do you select a turmeric supplement? So this is probably the best information that you're going to get from turmeric today. You want to really look at these percent of curcuminoids. So curcuminoids are the different active components to curcumin. And so you always want to see, what is it? Sometimes it's 10%, sometimes it's 20%, sometimes it's 40%. It's really important to look at that. Another thing that you want to look at is it an extract or is it just curcumin? So curcuma longa is a species. The extract is going to be a little bit more potent. So those are things that you want to look at. You want to look at, okay, is it just curcumin? Is it a complex? So some of them will say curcumin complex. That means that you're getting all those additional components as well. You want to see if it has black pepper in it. Does it have the piperine? So you'll see right there, piperine. Or does it carry a fat? Is it in a volatile oil? What is the carrier? Because once again, if you're buying turmeric and it does not have one of those components, then you're buying nothing because it's not going to get absorbed. Another thing, you want to start looking at the other ingredients. So is there corn? Is there soybean oil? Those are both very inflammatory. So you don't want to be putting things in your body that cause inflammation because then you're essentially kind of trying to cancel them out. I do recommend a minimum of at least 500 milligrams. And so not that I would expect you guys to whip out a calculator when you're at the store, but if you look at the total number of milligrams here, 700, you multiply it by the percent of curcuminoids, and that's the amount of curcumin that you're getting. And so those are marketing tactics that companies will use. They'll say, hey, you're going to get 1,000 milligrams, but it's going to be a 20% curcuminoid. Well, great. You're not getting a very good dose. Any questions on turmeric?
A couple questions from the chat. Would you please add, or the question is, what is the connection between turmeric and kidney stones?
The kidney stone pathway is usually due to the acidity within the blood. And so a lot of times that's due to inflammatory pathways. It could be dietary, it could be because the gut's not working. So there's a lot of things that kind of go into that. So I hope that kind of answers the question there. It's a tricky question.
And the other question is, what is your opinion of boswellia for inflammation, especially if turmeric causes a sensitivity reaction?
Absolutely. So boswellia root is really great for pain. Even with like chronic sinusitis, it can be really great for that. So I do like to use them actually in combination, or you can use it in combination with N-acetylcysteine, which is a anti-inflammatory agent that converts into glutathione, which is our body's most powerful antioxidant. So I would say if you don't tolerate turmeric well, boswellia can be a really good alternative. There are some pieces to boswellia that you do need to look for, very similar to turmeric with the percentage, the dose, and things of that nature. Just make sure you're getting a good product. So, and then I'm going to start with you in the back. Oh,
yeah,
sorry. Okay, I apologize.
not a problem. This applies to curcumin, but also to other supplements. Isn't this a bit misleading? The label tells us that there's 700 milligrams of curcumin, when in fact, it's only a percentage of the curcuminoids that are present.
Right.
Secondly, it's a turmeric extract. It doesn't tell us what else is in there that we may not want.
Correct.
There's no regulation, no standardization. You mentioned that there are 12 active components in turmeric.
Correct.
Same thing can be said about tea. There's caffeine, there's theine, but they don't have the very same effects. They're cousins chemically. Same thing here. There are 12 active components in curcumin, but how different are they chemically and how bioactive are they? Can you fill in some of the information here?
Yeah. So like you said, you've got these 12 active components. Not all of them are going to provide the same activity level. And so I'll probably go back to a little bit less, probably more understanding of a piece of this. If you look at estrogen, for example, there's 3 types of estrogen. There's estrone, estradiol, and estriol. Well, estradiol is your most active form. So if you're taking hormone replacement therapy and they give you a bunch of estriol, well, estriol is not a very active agent. So you're not going to get a whole lot of benefits, especially things for like hot flashes at night. So it's same theory goes back to turmeric. You're going to have some of those components that are just not as active. They do provide benefits because they are acting on different receptors, and that's where you get it. But you will never know what the breakdown is unless that company is willing to share their certificate of analysis with you, which shows you what's in it. Is it being, are they checking for bugs? Are they checking for purity? What the percentage is? So for example, in compounding pharmacy, we're allowed to be within 10% of the stated strength. So if it's a 100 milligram product, I could be at 90 milligrams or 110 milligrams, and that's considered okay. Now at Keystone, we try to be within 3%. And so you can have these big waves. So just like you said, you don't really know, even though it still says 70 or 700 milligrams and an 85% curcuminoid, you still may be getting nothing unless they show it within a certificate of analysis. And there are some companies who are more than willing to give you their products or their certificates because they say, hey, cool, I got nothing to hide. There are other companies that I've reached out to who refuse to give me their certificate of analysis. Now, the reason why a lot of times they try to refuse it is they have proprietary lists and they don't want you trying to copy their product. But as a healthcare professional, I'm like, I don't really care what your product's really like. I just want to know what it is. So that way when I talk to a patient about it, I can tell you what's in there.
Thank you.
Yep.
2 questions.
Sure.
I'm trying to figure out the words that tell me that there's an oil involved, and then I'm trying to figure out the words that I should avoid on the other ingredients.
Absolutely. So this one is not an oil-based product. This one's using the black pepper extract to increase absorption. So it would say something along the lines of liposomal. That's going to tell you that, hey, there's a fat carrier around it. It would say potentially nanoemulsion. It may say volatile oil. Those are probably the most common types that you would see on a product label. And it's almost always going to be either hidden in the supplement facts or in the other ingredients. So sometimes you'll see an oil carrier. It could be like sunflower oil. They use soybean oil. They use corn oil. So you have to be careful on what the oil carrier is as well. And then, sorry, the second piece of the question.
What words should I avoid under other ingredients?
So this is tricky. It's going to depend on the person. So some people are just more sensitive to inactive ingredients than other people. So for example, like you could probably throw just about anything in this other ingredients and it's not going to bother me. I have patients, if it says, even like silica sometimes will upset patients. And so I don't want to create like, oh my gosh, everything that they put into supplements is bad, but things that you definitely want to watch out for is corn or soy. Those would be the two components that I would always make sure you're looking at products and trying to avoid if you can. If you cannot, you know, it's not going to quote unquote kill anyone, but it does increase inflammation and we'd want to try to avoid that.
And your example up here is with the capsule. Is there also an oil base, a liquid base? And if there is one better than the other as far as absorption and
There
and
is
and quickness of
yeah.
activation?
Yeah, absolutely. So there are liposomal forms. They can come in capsules or it comes in liquid. Now, what I have been told from patients is that the liposomal forms sometimes have a less than desirable taste. So if you're very sensitive to taste, it might not be something that's right for you. But those liposomes do help get carried into the intestinal system for better absorption.
And we have one question from the chat about taking this with a good olive oil or a fish oil.
You could absolutely take it with an olive oil. I would just mix it in. So let's say you just bought turmeric powder from Costco once again. You could mix that in and take it almost like a shot. Or you could take it along with it. But I would probably recommend having it mixed together because the transit time of that oil versus that capsule is going to be different. And those capsules, depending on how well your GI system is, you may not break down that capsule very quickly. So you may start to absorb the oil before you actually absorb the capsule, which could be an issue. I'm sorry, I missed what was the other oil?
Oil.
You could do fish oil. It is a fat, so it will help out with absorption. But you're going to go down the same road as if you're taking your fish oil as a capsule, you're not going to get the benefit of taking them kind of together because wherever it gets absorbed, it may be absorbed at different areas of the intestinal system.
I just I see a lot of marketing where products are marketed as proprietary blends with a number of components to them as a general rule. If you can say something like that, are those kinds of things just marketing schemes, or is it good to have more than one of the nutrients and supplements you're talking about combined in one product?
So this is what my opinion is. I won't speak on Keystone's behalf or anything like that. My opinion is I try to avoid proprietary blends because I just don't know what I'm getting. It has nothing to do with the product. The product could be absolutely great if what's actually in there is at therapeutic levels for each of those agents. Perfect. I can totally understand why a company would want to protect their blend. But at the same point, I don't know what I'm getting. And if I don't know what I'm getting, I don't know what my patients are getting. And so I just don't typically recommend them. Now, what I will say is if you are taking a product that's a proprietary blend and it's working, I'll use the old motto, if it's not broke, don't fix it. As long as it's working for you, you're feeling good benefits, continue to use the product. There's nothing probably wrong with it. It's just, you don't necessarily know what you're getting.
Okay, I'm wondering if you're explaining something about us. We're in our mid-80s. We do not suffer from many of the restrictions that older people do. We're very flexible, energetic. But here's the thing that, all our lives, we've avoided salt and we flavored everything with pepper.
Okay.
And the other thing is he worked for a pharmaceutical company when he was young, and they told him the supplements is where he needed to go in his life. And we've been taking turmeric for many, many years. Are you telling me now that our lives have been affected by this habit that we've had for years and years?
So I can't say yes, but what I can say is that it's likely improved your overall health outcomes. But I can't, unless I were to do a study on you too, I couldn't say for sure if that's the main reason. Right, and it makes a lot of sense because you've been able to keep your GI system healthy. Likely you've been able to decrease inflammation, so you've got less damage to those organ systems. So there's a lot of those health benefits that you can see from just turmeric and what it does.
And one more question from the chat. What are the possible side effects of using turmeric?
So with most supplementation, it's going to be GI related. Upset stomach, gas, diarrhea, headaches is pretty common, but most supplements are pretty well tolerated. There's very few that cause, severe conditions unless you have some sort of major allergic issue. The other things that you'd want to watch out for is potential bleeding. So you take too much turmeric, you'd have to take a lot. It could increase bleeding, but with today's medications, most patients are no longer taking warfarin. They're taking a different generation of blood thinners. And so as long as you're consistent in taking that supplement while you're on it, it's typically not a big deal. But let's say you do see increases of bruising or bleeding while you floss your teeth, then I would say, hey, it's time to back down, or, let's talk to your primary care about that before continuing. Awesome. So curcumin, likely anti-aging. Let's talk about magnesium. So magnesium is probably one of my favorite supplements, but I believe it's also the most confusing supplement for consumers and patients to look at. So magnesium is required for us to do a lot of different processes throughout the body. For women, 320 milligrams a day is what's recommended. 320 is for men, 420 is for females. It's mostly absorbed once again in the small intestine. That's why the intestinal system is so important. Approximately 70% of the Western world is deficient. And that's once again, when I brought up my son's friend who is only eating Dino nuggets and only drinking milk, he's depleting their body. Unfortunately, the way that we farm fields now, we're not replacing a lot of magnesium back into the field. So a lot of our food is now also impacted. There's actually a really cool study, I want to say it was out of Switzerland. They looked at a hybrid tomato and a homegrown tomato that's never been genetically changed or modified. What they found out is when they compared the nutrition between the two, the homegrown tomato that's never been modified had more nutrients in it. And it also took 2 weeks longer for the hybrid tomato to mold. So the question is, what is in that that's causing it not to mold? So a lot of scary things within our diet nature. I know why they've done a lot of this, right? So that way we can transport food and things like that. But you do really need to be careful about the food that you're putting in your body. Magnesium is used in over 600 enzymatic processes. So as if you can imagine, 70% of us, so 7 out of 10 of us are probably deficient. And if we have 600 processes, that magnesium in the body is going to say, what's the most important to keep me alive? And it's going to put that magnesium in those processes. That's why most people have sleeping issues, because we can get by on 4 to 6 hours of sleep and stay alive. But if we don't get magnesium to the brain, we can't think. If we don't get magnesium to the heart, our heart doesn't beat. So it's really important that magnesium goes there instead of sleep. Medications like diuretics and proton pump inhibitors can decrease magnesium levels. This is a really great graphic of where symptoms of magnesium deficiency lie. And so things like muscle cramping, poor sleep, fatigue, depression. The reason why fatigue and depression on there is if you're familiar with tryptophan comes from things like turkey. That's why if you eat a bunch on Thanksgiving, you get tired and you want to sleep. The reason being is tryptophan is converted to 5-HTP. That process needs magnesium to convert. 5-HTP then converts into serotonin. So now we can see why it helps out with mood and even cardiovascular conditions. And then serotonin is converted into melatonin, which if you've ever gone shopping and you're like, hey, I should take some melatonin so I can sleep. Well, that's why that process and how it works. So if you're taking magnesium an hour before bedtime, it'll actually help out with sleep. Now it's going to be very specific on the type, which I will go into later, of what type of magnesium you should use. But that's really beneficial. Things like arrhythmias, right? There's magnesium channels on the heart, hypertension. So things, on average, it can lower blood pressure around 6 milligrams of mercury. Osteoporosis, magnesium is a key component in building bone. So, and I'm probably going on a soapbox here about osteoporosis, but so many people will come to the pharmacy and they say, I need calcium. I need calcium. I need calcium. And no, you don't necessarily need calcium. If I asked you to make me an apple pie and I just said, here's an apple, you still can't make apple pie, right? You can only do whatever you need with that single apple. Same thing in the body. If you just give it calcium, it still is not going to be able to make bone. You need things like magnesium, you need phosphorus, you need proteins. This is the recipe, quote unquote, for building bone. And so if you're missing one of those agents, you're just not going to be able to produce those things. Asthma, migraines, as well as endurance. So magnesium is really important in the formation of energy. And so it actually makes ATP, which ATP is the root source of our energy. So in the Krebs cycle, the main goal is to make ATP, and magnesium is a component in that process. So if you're ever feeling really tired and you're not sleeping well, you've got headaches and muscle cramps, well, you might be deficient in magnesium. Magnesium also helps with cell signaling. So when you hear friends or family and they say, hey, yeah, I feel like I'm getting a little brain fog, or I get a word stuck at the end of my tongue and I just can't say it. Like I want to say it, but it won't come out. It may just be that your cells aren't communicating properly because they don't have enough magnesium in order to do that. The ability to contract and relax your muscle. So Charlie horses, a lot of times people are like, hey, take some electrolytes. Well, what's in electrolytes? Well, magnesium and potassium and other components. And then it's also important for keeping those cells alive for organ function. Once again, our intestinal absorption decreases as we age, so we need to make sure that we're getting more of it into our diet. And intestinal absorption worsens with impaired vitamin D status. So as we continue to age, vitamin D also goes down lower. I'll talk about this a little bit later in the presentation. Reactive oxygen species and oxidative stress are ways of inflammation. Reactive oxygen species are made throughout the body. So as you exercise, actually, I'll step back real quick. If you have a vehicle that is driven by gasoline, when you push on the accelerator, your car goes, right? But what else does it do? Well, it produces exhaust, and exhaust, right, isn't great for the environment. Same thing in our body. When we produce energy from our cells, we get energy. Great, now we can go. But it also creates reactive oxygen species, which is an inflammatory mediator. And so magnesium can help with that reduction in process, as well as some of those markers. And so the term is called inflammaging, and that's where we get those inflammatory mediators here that we want to try to avoid. Magnesium also stabilizes the genome, so DNA, and by doing so, if you keep your DNA better together, you're going to decrease your aging. So at the ends of your DNA, you have what's called telomeres. Telomeres are essentially your body's true age. So I'm 31. If I have really short telomeres, my true body's age may be 37. If I've got really long telomeres, then I might be 26. And so magnesium can help protect that. Having lower levels of magnesium also reduces your cell viability, so your cells die off a little bit quicker. So if you're not keeping those cells around longer, let's say liver cells are not being replaced enough, you may start having backups in toxins and things of that nature, which then cause a lot of aging. So some other roles of magnesium, it can be used in asthma and allergies, it can be used in cancer. There's some data there. Cardiovascular disease is very important. Diabetes, the immune system, metabolic syndromes, muscle strength, osteoporosis, and psychiatric disorders. But are all types of magnesium the same? And this is one of the most frustrating parts of my job, I swear. So when you look at magnesium uptake, you can see the difference here. Most patients, when they come to me, they say, yeah, I take magnesium, I'm good. But they take magnesium oxide, and magnesium oxide is absorbed about 9%. Now, magnesium oxide is great if you are constipated and you need to go to the bathroom, because if you've ever mixed Kool-Aid together, you know that the color gets really concentrated, but as you stir it, it diffuses out. Well, same thing in the intestinal system. When you put a salt in there and it can't be absorbed, well, the body says, I got to push water in there to balance out that concentration. And that's how it helps out with a stool movement. Then you've got your sulfate. That's going to be at 22%, carbonate at 34%, and chelates are at 80% absorption. So chelates are going to be things like malate, glycinate, threonate, taurate. Those are probably the most common chelation magnesium types. And this was done by Weber State University. How do you select the right magnesium for you? So that I kind of talked about each one very briefly, but magnesium oxide, once again, that's going to be great for stool softening or heartburn because it does buffer the acidity level in the body. Magnesium citrate, once again, it's not greatly absorbed, similar to carbonate, about 30-ish%. It can help lower blood pressure as well as control blood sugar. Magnesium glycinate is probably one of my favorite types of magnesium. It helps out with mood support, sleep, cardiovascular function. Magnesium taurate, if you have heart conditions, can help out with heart health, blood pressure, and the nervous system. For my athletes, I always put them on magnesium malate. This is going to help out with energy production, muscle function. Once again, it's highly bioavailable. And then magnesium threonate is a unique one. So the studies say that magnesium threonate is the only magnesium that can cross the blood-brain barrier. This means that the magnesium can get directly to the cells and actually stop things like overstimulation. So when you hear of patients who have ADD or ADHD, can actually help out with them. There's a raw material called magtine, and that was studied by MIT for 10 years. And in their studies, they showed an increase in cognition and memory, as well as learning. So they showed for memory, 85% increase in long-term memory and 135% increase in short-term memory. Now, those studies were done on mice. So can we say, hey, in humans, are we going to see the same amount? I would say probably not. But I have had a lot of patients who I have started on that, and they have said, hey, I do feel like I'm remembering a little bit more. Now, what I would say is if you do start taking a product like that, you should document how well you are remembering things. Because if I were to ask you, how did you feel 90 days ago? I would probably say that probably most of us would say, I have no idea. And so really making sure that you're documenting things while you're taking supplements is going to be important, because then you actually know if is it working, is it not working? Do I feel different? Yes or no? There are some supplements, things that help out with cholesterol, that if your cholesterol goes down 30%, you're not going to be able to tell. So it's not an end all be all, but it is important to document those things. So once again, selecting a magnesium supplement, typically a recommended dose is going to vary between 200 to 800 milligrams of magnesium. Now, that's also going to depend on the type of magnesium that you select. 200 milligrams of a magnesium chelate versus 800 milligrams of maybe like a magnesium citrate. Now, you can dose magnesium quite high. Essentially, dose it until you get a bowel movement or you start getting a lot of diarrhea. Then you know you've gone too high and you need to bring it down. You're not typically going to get arrhythmias before you get diarrhea. Now, so for example, I have patients who have chronic migraines, actually my best friend's wife. I dosed her to about 5,000 milligrams of magnesium. So you can dose pretty high. Now that's not all at once. Obviously that's throughout the day, things of that nature. So you can vary that dose, but that's a very typical recommendation. 200 to 800 milligrams is going to be good for most people. Once again, selecting the type of magnesium based on your symptoms. Are you having more blood pressure issues? Are you having more sleep disorders? Are you not remembering things? We want to make sure we're picking the right one. I always recommend chelated forms. Once again, if you're going to be spending money on supplements, you might as well get one that you can actually absorb. And as we continue to age, if we're not already absorbing nutrients very well, let's get one that can. And then the timing of the dose does vary. So if I have somebody who has sleep issues, I'm going to have them take it 1 hour before bedtime. If I have that same patient and I give it to them in the morning, well, it may help improve concentration or memory or anxiety, mood. But the body is going to decide, right? It's not going to make more melatonin during the day because your body's supposed to be awake during the day. So it says, cool, I'm not going to go from serotonin to melatonin. I'm just going to stay at serotonin and I'll use it for my mood or I'll use it for cardiovascular health. This is a product that uses a combination. So once again, you don't know how many milligrams of each one you're getting. I know because I have the certificate of analysis, but it's a nice blend. So you have a dimagnesium malate, that's a chelated form. You're going to get some mag citrate. That's going to help out with your GI function. So this is kind of an all-around product. And then you have a glycinated chelate. So you're getting glycine, malate, and citrate. So it's a nice blend there. What questions do you guys have on magnesium?
I have just two quick questions. I have a friend who has tingling, wakes up in the morning, his fingers are numb. And would magnesium, based on some of the things you said, be helpful for him? And then the second part of that is he also has neuropathy. Does this impact neuropathy in any way? Magnesium.
So magnesium can help out with neuropathy. Now, depending on, I'm going to be very hesitant to say like, hey, you should be on magnesium without knowing more about, health history and things of that nature. I probably wouldn't start with magnesium initially, unless there's other circumstances, especially in diabetic neuropathy. I would typically start off with vitamin B, so B complex. Those are very neuroprotective, as well as alpha lipoic acid. And that's also very neuroprotective, and you'll get better benefits, at least that are noticeable, from that combination than probably starting off magnesium. Now, if they're truly magnesium deficient, then it is, starting some magnesium would be important. Now, one of the important things is you can get a blood level of your magnesium level, but the serum blood level tells you nothing. Magnesium is a intracellular ion, so it does all of its work inside the cell. And so you have to check a red blood cell magnesium to know if you're really deficient or not. Now, that only tells you a 90-day status window. So let's say 180 days you were deficient, you wouldn't know because blood cells only stay around in the body for about 90 days. So other questions?
I have heard that high levels of magnesium can cause vivid dreams. Have you heard anything like that at all?
So I could see how it could potentially work, especially through increasing serotonin and melatonin. Those are going to help out with dream status, or increasing serotonin can lead to vivid dreams. That's why a lot of antipsychotics can cause vivid dreams, things like amitriptyline, even like fluoxetine, sertraline. A lot of those antidepressants can cause vivid dreams because they're increasing the amount of serotonin that stays in the body.
We have several people online who are interested in your slides. Would you be able to make them available?
Yeah, that'd be absolutely fine.
On supplement bottles, sometimes I will see a reference to the US Pharmacopoeia. Is that any kind of reassurance that something is, it actually contains what it says it contains? US Pharmacopoeia?
So yes and no. That means that at the time that bottle was made, it had that dose. But by the time that product gets to the shelf, it degrades, right? Just like everything else. So by the time you actually get it, are you truly getting that dose? So for example, and I don't have I'm not talking about probiotics today, but probiotics are a great example. There was a study done with 35 different probiotic companies. They all had their products analyzed, and 33 out of the 35 did not have what they said was in there. In fact, most of them had nothing, because those probiotics, they die over time if you don't take care of them correctly. Two of them had low amounts of what they said was actually in the product. So probiotics are a really tricky one to make sure you're actually getting the benefits of them. Typically, they either need to be nitrogen purged, so that means you're removing out all of the oxygen. The other way it can be is there's an air drying process. So they shoot the probiotics up and they get covered. They get this coating on them, and that protects them from oxygen degradation. And so probiotics are very sensitive. The way that they get transported, if they're transported just in a truck and it gets really hot, that breaks it down. Same thing with fish oil. And I talk about fish oil here, I want to say next. You get a bad fish oil when you have fishy burps. If you can't take that capsule and throw it in your mouth and bite it, and you shouldn't taste anything. Fish oil, a really clean fish oil product has almost no taste. And that's how you know if the product is rancid or not. So. Any other questions?
Is there anything that lowers magnesium in your body, i.e. coffee, alcohol, caffeine?
Yeah, there are. So I talked about like dairy. Dairy will decrease magnesium. High levels of protein sometimes can decrease magnesium. Alcohol can decrease magnesium. I mean, there's lots of things. But the big one I would say is dairy, just because, especially us living in the Midwest, a lot of us do have higher intakes of dairy than other places in the world. And so that would be the big one I would watch out for. Now, once again, I'm not saying don't have dairy, just don't overconsume. It's all, don't eat, cereal and milk, and then later for lunch have a glass of milk with a sandwich, and then have another glass of milk later, and then have ice cream later after that. We're just consuming a lot is all. Oh, go ahead.
There are dozens of brands of supplements, and every store that we go into has their own house brand.
Mm-hmm.
Do you have a brand that you recommend that would have exactly what it has on the bottle, safe to take, that you can trust?
Am I allowed to say brands? This isn't for CE, so I should be good to say. So yes, I do. I would stick to health professional brands. I do talk about this later as well. A health professional brand. So it should be, typically you should only be able to get it at a doctor, chiropractor, some sort of healthcare provider. Most of the brands that those healthcare providers are going to have are doing third-party testing. They provide the certificates of analysis. They're just more brand, they're more trustworthy, I should say. Now, you can also have bad products from those companies. So don't get me wrong, not all the products from them are great. If you find somebody, I would love to say, like, to put it in perspective, I guess, I do what's called contract manufacturing. So I formulate my own products. I have it made at a warehouse that does all this kind of stuff. So that way I'm in control of everything that goes into that product. I know the inactive ingredients. I know the exact amount of magnesium that's in there. I know the exact amount of, D3 or whatever other components. And then I force them to give me a COA. And I have the certificate of analysis of my compound or my supplement, as well as the certificate of analysis of all the raw materials. So just because they tell me, hey, yep, there is 5,000 international units of vitamin D in there, I want to know, okay, who'd you buy that vitamin D from? Is it even a good source? So for example, berberine, which is a very popular supplement right now, berberine was contaminated and they're putting it into products. And yeah, was there 500 milligrams of berberine in the product? Yes, but there was also a fungus with it. That's also why they pulled a lot of fiber off the market. almost all of the psyllium in the market right now is contaminated with a fungus. And a lot of places are still selling it, but reputable companies will pull it off. So another really great company, Orthomolecular, they do a really good job. They actually they were one of the first to pull their psyllium off the market because they said, hey, we can't get a clean source, we're not going to make it. Sorry, you'll have to use a different type of fiber product. I really like, so if I had to list all the ones I like the Keystone brand. I don't say that just because I work for them. I say that because for most of the products I actually formulate. And so I actually know what's in there. So I can trust it. It's more of a trust thing than like anything else. Orthomolecular is great. Pure encapsulations can be good. Metagenics used to be really good. Now some of their products, maybe not so much. They were bought out a few years ago. And so the companies started to change things in the ingredient label. So for example, I know this one doesn't show inactive ingredients. But for example, in a lot of their products that they used to have magnesium glycinate, they switched it out for magnesium oxide. You don't notice it unless you read the label, but they're just cost savings on the raw materials. So there are tricks to that. Designs for Health is another really great company. New Medica is another good company. So there's a lot of reputable companies out there. Even, Nature Made can be good, but I would never buy their fish oil. So you can find companies like that are a little bit more cost effective, but you are going to give up on quality. A lot of those companies, Nature's Made, Nature's Truth, Nature's Bounty, they use poor raw materials. A lot of times they have a lot of corn oil or soybean oil in their products. So that's why I don't typically recommend those. Any other questions? Okay. So fish oil. Fish oil can be tricky because just like how I mentioned about the travel time for probiotics, the travel time for fish oil can be pretty extensive. Most fish oil is caught off of the northern coast of South America. And then most companies then ship their fish oil that are caught. They're sometimes processed there. Otherwise, they're sent to a South Asian country to be processed. That process generally takes 6 to 8 months. Then it sits on a ship for 6 to 8 months. And then it finally gets to the warehouse. It sits there for 6 to 8 months. And then it gets onto your shelf. So for some companies that I prefer, they actually have their manufacturing process directly across from the wharf. It's made in a few months and then it gets put onto the shelf. So that's how you typically know if a fish oil is good, because the quality is a lot better. It doesn't smell, it doesn't taste bad, it doesn't make you burp. Those are a lot of things with fish oil that you should be checking. And so if you take fish oil at home, go home and bite into it. And if it makes you want to gag or vomit, please change your fish oil. I have bit into almost every single fish oil product on the market. To go back on the brand questions there's only a few I would recommend. One would be Orthomolecular. They've got a really great fish oil. The other is Carlson. Carlson brand has a really great fish oil as well that's nice and clean. So those would be the two I would recommend. Fish oil contains omega-3s. That's where it gets, most of its benefits. There are 3 types of omega-3 fatty acids. One is EPA, the other is DHA, and the third is ALA, which is mostly found in plants. So if you see like algae products, there's omega-3s in an algae formed product. Dietary intake of fish should be about 3 servings or about 8 ounces a week. So if you don't eat fish at least 3 times a week, you probably should be supplementing. Now, I do recommend if you are going to try to get it all the way through dietary, try to stick to more of like the pink fish. Avoid things like cod or whitefish that typically has lower levels. But then you also have to worry about if you're eating more fish, you're potentially getting more mercury. So in fish oil products, it is important to make sure it's triple distilled because they're going to remove a lot of those oil or the mercury base out of it. Dosing is going to be about 2 to 4 grams daily. And so that's important to look at. You will get a fish oil product. It will say 2,000 milligrams. But then when you look at EPA and DHA, the total's 300. Well, you're not really getting 2 grams of fish oil, you're getting 300 that's actually beneficial. So you want to make sure that the total of the EPA and DHA is going to be close to, a gram, 1,000 milligrams, 2,000 milligrams. So that way, hey, I need to take 1 or 2 capsules and to get my daily serving. A lot of clinicians will tell you not to take fish oil because it can cause blood thinning effects. That's typically only seen after 4 to 5 grams. So you can take it even if you are on a blood thinner. Once again, it's about consistency. If you are taking warfarin, make sure that you are checking your INR frequently. So that way, if there does need to be a dosage adjustment that can be made, but most patients are on the new age blood thinners that as long as you're consistent, it's not a big issue. And typically the main sources are going to be salmon, herring, mackerel, or sardines. So a lot of companies will actually put the source that they get it from on the bottle. So if you look for it, it should come from one of those 4 sources. Fish oil benefits include field development. So all of my my pregnant patients, I put them on a fish oil. Not only does it help them out, but it helps out the baby. It does help out with neuronal, retinal, and immune function, as well as cardiovascular function. It does reduce inflammation. It can help out with peripheral artery disease, as well as coronary events and anticoagulation. It's important for the cell membrane health. And so once again, when we talk about Alzheimer's disease and cognition, we want to think about the cell and how it communicates. If I were to take your cell phone and I crushed it, you wouldn't be able to call anyone, right? Or text anyone. You're signaling to somebody else's damper. Same thing with our cells. When we don't have enough fat in that cell membrane, the cell shape is damaged or adjusted. And so cell signals don't go in and out very well. And so typically you'll get, brain fog is the most common one that I typically see. You'll have issues saying words, remembering when your appointments are, things of that nature. Fish oil can also help out with weight management. It does that because it's helping out the cell membrane, and because your signaling is better, you can produce energy better through magnesium and ATP. So it can also help out with weight management. But I would say if you're looking to lose weight, I would not just take fish oil and expect it to shave off pounds. So this was a really interesting study where they looked at anti-aging in fish oil. They took 138 sedentary, overweight, middle-aged participants. And what they found is fish oil reduced cortisol levels. It also reduced inflammation and it boosted our repair mechanisms. And so by doing that, when you reduce cortisol and inflammation, you're going to reduce the aging process. And I've got a slide coming up here with cortisol. So I'll dive, it's right there. So cortisol is a big issue in the US. If you know somebody who is fatigued all the time, they always want to take a nap, they probably have a cortisol issue. If you have somebody who has potentially high blood sugar and high cholesterol, they potentially have an adrenal issue with cortisol. If you know somebody who has issues forming words, cognition issues, could be potentially adrenal dysfunction. If you have somebody who lost the interest that they used to like, I like to play golf. I'm not very good at it, but I do enjoy it. But my wife knows something's going on and I'm like, yeah, I don't really want to play golf. I just want to sit at home. Typically an adrenal issue due to cortisol. So what cortisol does is it decreases immune function. It decreases neurogenesis. It actually impacts our insulin. That's why you see blood sugar go up. It increases blood pressure. So individuals who are stressed that typically have higher blood pressure because their heart rate goes up. If you've ever been chased by a lion, which luckily most of us haven't, those individuals who have these chronic conditions from this are typically what we call in sympathetic overdrive. It's like they're always being chased by a lion and they just can't get out of it. They have racing thoughts. If you ever wake up in the middle of the night and you're sitting there and you're like, why can't I fall asleep? I wish I could fall asleep. I should be asleep. It's 3 o'clock in the morning. I can't go to sleep. That's typically an adrenal issue, especially if you're waking up between the times of 1 and 3 o'clock. I'm not just saying if you have to go up and go use the bathroom, you come back to bed, but if you're waking up between 1 and 3 o'clock consistently, it's probably an adrenal issue with cortisol. And so if we can get you better sleep, if we can reduce cortisol, fish oil can be really beneficial in actually helping out with that aging process that occurs. Some other things that cortisol does impact is going to be your bone health as well as your muscle health. So it can cause sarcopenia, it can cause osteoporosis. So cortisol can be really damaging to the body, and that study was really cool to see that it decreased cortisol. Another study kind of looked at 5 different clinical trials, and what they found out is that fish oil was actually positively associated with telomere length. So once again, when I talked about telomere length earlier, it was actually able to keep that length where it was at. So it reduced the breakdown of it. You're never generally going to be able to take your telomeres and expand them out. Once it's gone, it's gone. But if you can keep them longer, then you will see improvements in anti-aging. I would say on that probably more research is needed. Those studies weren't super in depth, and there was a couple biases in them, honestly. So it's not something I would take to heart, but it does have some potential. So another study looked at autoimmune diseases, and what they were able to see is that fish oil was actually able to help out with inflammation, which then helps out with autoimmune diseases. Some really important ones would be like multiple sclerosis, as well as even like Lyme disease. They saw some improvement. I know it's not autoimmune, but there is some data that shows that it can help out with Lyme disease. There were some placebo-controlled trials done on fish oil, and they were looking at inflammatory diseases, and they saw a decrease in the disease activity, so less symptoms, as well as the patients didn't need as high of a dose of their anti-inflammatory drugs. So how should you select a fish oil? I always recommend smelling and tasting your fish oil. If it's rancid, you should throw it away. Honestly, it's probably super old. It might contain some particles or things in there that you don't like mercury. They should be nice and clean. You also want to look at the total omega. So once again, when I had talked about this, sometimes you'll see just fish oil here, and it'll say 2,000 milligrams. But what you want to look at is how many of those are really omega-3s. So here you can see that this product has EPA, DHA, and this additional is actually going to be ALA. And that totals for 950 milligrams in one capsule. So in order to get to that 2 to 4 grams, you do need to take 2 to 4 capsules. Now, most fish oil, unfortunately, is going to be a larger size capsule. It's not going to be a teeny itsy bitsy one. I wish they could do that, because then I could get my kids to take it a little bit easier. Now, the other side with fish oil is you are going to get some calories from it, because it is an oil. But those would be some really big things that you can see there. Now, fish oil does come in capsules or liquid, so whichever you prefer is fine. I would just make sure that if you do get a liquid product, get it from a reputable company. Otherwise, it will taste terrible. And typically they're flavored lemon or orange. That's the most common flavors that you'll see with it. So you unfortunately get some sort of added flavor. So if you are trying to minimize additional ingredients into your fish oil, just be aware of that. Any questions on fish oil?
When Karen asks, for somebody who is allergic to fish and shellfish, can they still take fish oil?
Yes, you could get it through algae. So there's an algae, a plant-based algae product that has omega-3s in it.
In this,
It's not technically fish oil, but the omega-3s is the important piece of the fish oil.
in this example, did I understand you right that you need to take 2 of these a day?
So to get into the optimal dose at 2 to 4 gram range, yes, 2 would be the dose.
I thought there was some recent research where omega-3s for people that have had a cardiovascular event, it was not recommended from a preventative, but it's within the last 3 months that I heard this, that there's been some new data.
Yeah, there is some data depending on the condition that it's not recommended for. So knowing what condition, now conditions like atrial fibrillation, where the heart is rapidly beating, it is actually beneficial for because it's anticoagulant benefits. But typically, right, you have to use higher doses to get that anticoagulation. But yes, there are some conditions that it's not beneficial for. There's also a lot of studies that are now starting to show potentially not as great heart benefits that we used to think of. And those probably for the last 7 years or so, probably 1 or 2 studies a year has shown kind of like, we don't really know if this is having the same benefits that we think. But there's really no definitive studies that are like absolutely not, or hey, don't use it. It's just, it potentially doesn't have the same benefits that we thought, because a lot of those models, once again, are done typically in mice or in nematode. I mean, not in fish oil, but typically mice or even pigs. So.
In the brands of supplements you mentioned, Lori wonders, she couldn't remember if you mentioned Standard Process as a recommended brand.
So Standard Process is a decent brand. I don't typically use them because they're very much a chiropractor brand. I don't mean that in a bad way by any means, but that company typically targets chiropractors as their main resellers. And so I don't typically use them personally. Standard Process uses a lot of bovine products or different components of glandular from pigs or other sources. And so you just have to be careful about what's in the product is all. They're a great company, don't get me wrong. I just don't personally use them, so I don't know enough about their fish oil to give her a great answer. But could be, if I get her email or a contact, I can look into their product and let her know. That was Standard Process. Awesome. So vitamin D, and this is probably one of the most sold supplements in the US, especially anyone who lives above the 37th parallel, where we just don't get enough sun. And that could be either because of your job or other factors like that. So vitamin D is a fat soluble hormone. It's not technically a vitamin. Now, there's a difference between fat soluble vitamins and water soluble vitamins. Fat soluble vitamins you can become toxic to. Water soluble vitamins, you don't generally develop toxicity. Generally, you just develop expensive urine. Now, there's one exception with vitamin B. So vitamin B is a water soluble vitamin. The only type of B form that I am familiar with that potentially can cause toxicity is B12. So you can potentially take too much B12, but you'd have to take quite a bit, and most patients don't have an issue. But your fat soluble vitamins, it is a potential to get too much and go toxic. There are two main types of vitamin D. There's D2 and D3. D2 is a plant source, where D3 is animal sourced. D3 is more effective at increasing the vitamin D levels. So when you look at the labeling on the bottle, you want to look for calciferol versus ergocalciferol. There are vitamin D receptors all over the body. So it's not just, hey, I take vitamin D for my bones. It's going to affect everything in the body. Now, this is where you'll see some disagreements. So since I practice more of an integrative functional medicine type practice, my optimal range for vitamin D is between 50 and 80. I typically like to see patients at the higher level, that 70 to 80 mark for immune function. So if they're heavily immune impacted, I try to get their levels a little bit up. They have autoimmune type conditions. Once again, I like to see a little bit higher of a level. The normal range on lab work is going to be between 30 and 100. So I have patients who commonly come to see me and they're like, hey, I've got great vitamin D. And we look at their labs and their level's 35. And I'm like, yeah, no, that's not good. And the reason why I like that range so much is if you go to a lab and let's say your vitamin D was 31. Well, a lot of physicians, and I'm not picking on physicians at all, but there's a lot of providers who will say, yeah, you're fine. Well, if you are at 29, are you still fine? Well, no, now you're deficient. So why are we treating it, at a lower level and saying people are okay? So we do want to try to get to that 50 to 80 mark. Dosing for vitamin D generally will range from 400 international units to 50,000 international units. That also varies on the type. So you typically see D2 as 50,000 international units. That's going to be like the once a week kind of vitamin D versus 400 international units, 1,000, 2,000 will be kind of like a daily dose. Some factors that affect vitamin D is going to be age, right? So as we increase in age, our vitamin D status goes down, and that's because our organs don't work as well. The big organ that we worry about with vitamin D is going to be the kidneys. So if your kidney function's not good, you're generally not going to be able to metabolize vitamin D correctly. Vitamin D is also metabolized by the liver. your race plays a role. So there are lower levels seen in non-Hispanic, African American, and Mexican Americans. That joke goes back to the melanin in the skin and the inability to convert it. Females are at higher risk. Individuals who are smokers have reduced vitamin D levels. If you are overweight, you have reduced, typically have reduced vitamin D levels. And then once again, living above the 37th parallel. And that generally cuts through like South Colorado to Northern Virginia and up. So all of us here are above the 37th parallel. Some symptoms of vitamin D deficiency. It's going to be hair loss, changes in mood, increased rate of fractures, slower wound healing, decreased bone density, muscle weakness, worsening blood pressure, constant pain, chronic fatigue, infertility, decreased endurance, and impaired immunity. So there are a lot of symptoms associated with vitamin D, but sometimes you don't know if it's technically vitamin D or is it magnesium or is it this. So knowing what your levels are is really important. Vitamin D's role, it does help out pretty significantly in my autoimmune patients. It does help out with bone health, and that's because it's able to help lock calcium into the bone. Brain health, cancer, cardiovascular, depression, and mood. So a lot of seasonal affective disorder, right? We typically see from low levels of vitamin D. I want to say that Michigan, at least the west coast of Michigan, was just behind Washington State for the most amount of cloudy days. And so as you can imagine, we just don't get enough sun. And so that can definitely impact our D level, which impacts our mood. Energy levels, immune function, muscle function, type 2 diabetes. It actually plays a really great role there. And it can help out with weight loss. Once again, the way that it helps out with weight loss is that it's helping out with generally mood and energy. Because you get better mood and more energy, you typically are eating a better diet and exercising, and then weight comes off. So please don't expect to just take vitamin D to lose weight. As we age, we do have decreased calcium absorption. So we do see more osteoporosis. And so that's why we need to make sure that we are getting more of those building blocks to the bones there. So vitamin D does play a really great role in helping with that absorption. There's a intestinal resistance to calcium absorption, and that's seen as we age. There's less vitamin D receptors in the body as we age. The production from the kidneys decreases, the production from the skin decreases, right? Because by age 20, our skin, our hair, right, is beginning to be impacted by age. So we're going to start seeing that at an early amount. Typically, as we age, our diet changes. And so our vitamin D levels do go down further. Vitamin D does delay aging because it downregulates what's called NF-kappa beta, which is a immune marker. So it's limiting inflammation. So this was a study that was done looking at the longevity through a stress response. And so what they found is that vitamin D promoted protein homeostasis. So what that does is it slows down the aging. This was done in nematodes. Once again, nematodes, they have short life. So seeing that increase is pretty easy to see. So I wouldn't necessarily say that we're going to see this in humans, but there's evidence that it does do that. It does reduce amyloid plaques, so it can help out with cognition potentially, especially in individuals who have Alzheimer's. That was done in a mouse model. So once again, it's not a human, so I wouldn't say, for sure that it's going to do that, but there's some evidence that it can. How to select a vitamin D product. So if you live in Michigan, which I'm assuming almost everyone typically lives here almost all year, or if you do go down to, Florida or Arizona or another state during the winter, I would say between 1,000 to 5,000 international units is the recommended dose. For my adult patients that I see, I always do a lab level first, but most of my patients who are adults, I start them at 5,000 international units. Now, with vitamin D, it is important to take K2 with it. What happens is when you take vitamin D, you increase the serum level of your vitamin D, which communicates with your parathyroid. When the level in the blood gets too high, the parathyroid kind of freaks out and it will pull calcium from the bones and put it into the blood. Once there's calcium in the blood, it will circulate through, but when the body doesn't know what to do with it, it stores it in the blood vessels, which then calcify your veins and arteries. This isn't good because we want to avoid heart attacks. We want to avoid cardiovascular events. And so what K2 does is it locks calcium in the bone and out of the arteries. And so I would recommend taking K2 with it, specifically MK7. There's different types of K2 or vitamin K. There's MK4 and MK7. MK7 is a little bit better at keeping calcium out of the arteries because it's better absorbed. Once again, with vitamin K, it does cause clotting. So if you're taking a blood thinner, especially warfarin, be very cautious in that. The new age blood thinners, you can take a lower dose and be just fine. 180 to 360 micrograms of K2 is what I would recommend, especially in individuals who already have, cardiovascular events, or they know that their calcium score is really high in their arteries. I would recommend taking 360 micrograms. Even individuals who have high blood pressure, typically, you know that there's an occlusion somewhere that's causing that pressure to increase. So having some K2 for that is also important. Erectile dysfunction can be impacted and can be potentially improved by K2. So having it in there with your vitamin D is important. Magnesium is also another product that I always recommend to take with vitamin D. Magnesium helps activate and transport vitamin D. So as you can imagine, if we're already increasing our age, we're not able to absorb things as well because our gut's impacted, as well as transporting it because our organs and our other functions don't work as well. So being able to improve that is important. Now, what I will say is your vitamin D also is the absorption and transportation varies based on your genetics. If you don't know what your genetics are, you don't know really how you're absorbing different nutrients. So if it is something that, let's say you're taking 5,000 international units, but your levels are still low, I would look at your genes to see what's going on, because it could be that you're just not activating or transporting it very well. And that's why I just recommend to take some magnesium with it to try to help avoid that. You do want to avoid corn or soy oil. That's very commonly seen in cheaper products. So for example, and I'm not picking on Nature Made, but this is a Nature Made product, and you can see here they've got soybean oil in there. That's going to cause some inflammation. And then soybeans do have estrogenic-like effects. And other ways to get better absorption, you can use liposomal forms. There's a form called micellized, which is touted to be the best absorption. I would honestly argue against that. That's more of like a marketing scheme, the micellized. Now, there are some studies that do show better absorption with it, but pretty few cases. There's emulsions, and then there's micro encapsulated. That's the most common type. That's the one that you always see like the capsules of. Micellized and liposomals are going to be your liquid products. There's a study that looks at all three of them, the liposomal, micellized, and the microencapsulated. And the microencapsulated showed just as good of benefits and absorption. So I don't see any reason to spend more money on a vitamin D product for a liposomal or micellized unless you're really struggling to increase your levels. Any questions on vitamin D?
Thank you. You mentioned that vitamin D is not technically a vitamin. So how does one distinguish a vitamin from a hormone? And why is this a hormone?
So it's based off of the chemical structure. So it actually has a steroidogenic ring on it that kind of keeps it more of as a hormone than as a vitamin.
I have a question about calcium. Is there a good calcium supplement for someone who is sensitive to dairy?
Yes. There are lots of different good calcium products. I don't typically recommend calcium because we do get a lot of it through our diet. And so what you typically see is we have these patients who get higher levels of calcium and potentially calcium buildup in their arteries and veins. And so, obviously this is going to be patient to patient specific, but calcium carbonate could be really great. You do want to take it with vitamin D to help out with the absorption. And then you do with calcium, you want to split up the dosing because you can't absorb it all at once. So, but if they wanted more specific information, I can follow up with them. But it's going to be patient to patient.
Any recommendations regarding the timing and the size of portions within a day?
So as far as timing goes, I would recommend taking it at night and with a meal. So because vitamin D is a fat soluble hormone, it's going to be best absorbed with other food and other fats in there. The reason why I would recommend taking it at night is vitamin D can help you fall asleep. So there's some sleep benefits there in individuals who are deficient. If your level is normal, it's not probably going to help you sleep any better than what you're sleeping now.
Do you sell your products directly to consumer, and how would one access that?
So yes, we do sell our products direct to consumer. So that would be on our online store. Now what I will say is I don't necessarily always just recommend people going online just to purchase supplements. I think they should talk to a healthcare practitioner first to make sure it's right for them, because so many times that we see these products advertised to us or we're told from a friend that it's good for us, and it may not necessarily be the right choice for you. So I would recommend talking to a healthcare practitioner. Something I'm really trying not to promote Keystone if I can't, but one of the things that I do there is I do supplement optimization. So patients will come to me, they'll bring their lab work, they bring their medications, they bring their supplements. I sit down and I talk to them. I say, okay, Susie, I'm not saying your name, Susie, but Susie, this is what we know. We know you've got X, Y, and Z. This level's low. This is what your diet looks like. Do you want to just change it with diet first? Because if we can just change it with diet, there's no reason for supplementation. If we can't change it with diet, which most of us unfortunately have a hard time changing our diets, especially if you've got kids and things. I don't know how many times I've come home and I'm just tired. My wife is tired, and we're just making mac and cheese. I don't even care. Like, we try to eat healthy as much as we can, but I totally understand when it doesn't occur. So I would say, setting up an appointment with a healthcare practitioner would be the best idea. Now, if you're just looking to replace a product, let's say you already have been told to take vitamin D and you're looking for a better vitamin D product, then yes, then I would say go ahead and you can go online, and there's tons of different options that we have on our website. They're all professional healthcare practitioner brands. Specifically, if you look for like Keystone products, there's a black label product. Those are products that are specifically formulated from either myself or another colleague there at the pharmacy, that we have more control of what's going in that product. Some of our other products, and I don't mind sharing this. So a lot of what you'll see from healthcare practitioners or even brands on the market is that they're private labeled. Private labeled means that the product is made at one source and they just change the label name. The product's not actually different. I'm going to say something after the presentation that I just don't want on recorded. Because I'll probably get in a little bit of trouble. But what I can say is that I have been to facilities who make multiple different manufacturer products, and the same product goes into the same bottle, but with a different name, and the pricing is different. So a lot of it is a marketing scheme. And so that's the one nice thing about that. So we have products at the store that we don't make that has our name on it, but they're made from high quality reputation brands. So we're in Grand Rapids off the corner of East Paris and Cascade, right there off the highway.
Any more questions? One more.
You haven't mentioned Prevagen and that whole group of brain stimulators. They get a lot of TV ads. Care to make any comments? And I think Keystone makes the product too.
So I'm going to talk about my own opinion and opinion that is not reflected by Keystone. I don't recommend Prevagen. I don't think that the products is very good. And I talked to the CEO from Prevagen and he kind of alluded to that the product is crap. So I don't recommend it for that reason. I've also had a lot of patients that have not had a lot of success with it. So anecdotally, I don't see the benefits there with my patients. But that's my own opinion. Yeah, the studies aren't great. They're pretty biased. So it's just not something that I personally recommend. I try to go elsewhere and look at things like, okay, what's going on with the cell? Do you have enough, fat around the cell so that way it's communicating correctly? Is it a stress issue? Which more oftentimes it's a stress issue, or even as we age, right, our hormones go down. And a lot of times, especially in females, it's an estrogen issue. And you can balance it out with just getting better hormones.
One more.
Just curious as to, if I were to contact you and say, I'd like to have a meeting with you, how would you go about determining? Do you do blood tests? Do you do, how much analysis do you do of my gene structure in order to provide for me what, say, for example, I need?
Absolutely. So a lot of it comes down to costs. What are you willing to pay for, essentially? So what I do is, let's say I can do whatever I want to do. And the patient says, cool, I'm willing to spend whatever I'm willing to spend to get what I want done. I would typically start off with a genetic blood test that I'm looking at the white blood cell and the red blood cell and the serum and seeing what all the levels are and what all the genetics are. I want to say that test costs $4.99. And what I do at my practice is all my lab tests I don't upcharge for. I just give you guys the same price that I would pay. And that helps try to keep costs low. So if I had a choice, that's where I would start. For most of my patients, cost is an issue. And so what we do is we just do serum lab levels or blood draws from a close by lab, or I contact their primary care. A lot of times I work with the primary care offices and I just say, hey, I saw Susie in the office today. I'm recommending X, Y, and Z lab. A lot of times I need a red blood cell magnesium. Cool. We'll get it done at the next blood draw. And then I use the lab work that they already have. I typically don't recommend using old lab work because you're not the same person you were a year ago or even 6 months ago. We know that those levels can change. And so I'd like to try to get new blood work. The other reason why I like to get new blood work is it gives me a starting point of when you started seeing me. So for example, I had a patient who had a cholesterol level of 241, which is elevated. I started them on a product and in 40 days, we dropped their cholesterol from 241 to 180. And I know that because I got them tested before they started working with me, and we were kind of excited because it's a newer product. And then we rechecked them at day 40 because they wanted to know. And I said, well, typically let's wait 90 days. They didn't want to wait. So if you don't know where you're truly starting at, let's say you had blood work from a year ago, well, you might not really have a cholesterol level of 241. So that if I drop you to 180, how much should I really drop you? Because you could have been at 190 or you could have been at 181. It's like, did I really do anything? No. And so that's why I would recommend blood work. But the way I work is I look at all of your blood work, any genetic tests that you may have, any conditions that you've already been diagnosed with. I look at your medications. I look at your supplements. I typically will start at your birth. So how were you born? Were you a C-section or were you born vaginally? Because that's going to depend on what happens with your GI health and your microbiota. So if you're born vaginally, you have a different microbiota than if you're born via C-section. Then I'll go through your childhood. Did you have a stressful life? Did you go through abuse? There are patients who tell me that they were raped as a child or they were physically abused in some sort of fashion. And a lot of times in those cases, I'm going to refer them out to somebody else for that specific issue because I'm just not going to be able to address it. That's outside of my scope of practice. I'll ask them about bullying. Were they bullied? What kind of foods did you eat growing up? Did you have well water or did you have city water? Was there any sort of purification system on the water that you drink. Because I know that individuals who grew up in Rockford and drink well water off of Rockford have high levels of PFAS, and that increases a lot of inflammation and leads to a lot of different types of cancers. So then I know, like, hey, we need to probably be a little bit more aggressive in looking at how can we reduce those levels. Then I go through college. Where'd you go to college? Because once again, depending on where you were, where you lived at, you may be exposed to different environmental toxins. And so kind of working up all the way throughout your life until we get to current day. And that's how I practice. So I would say my average meeting typically lasts, but my initial meeting typically lasts 2 to 3 hours. So
Unfortunately, we've run out of time here. We'd love to talk to you all day. But thank you very much, Logan. I don't know if you've got time to stick around and answer
absolutely
off the cuff questions, but thank you so much for speaking with us today. I think we all learned something.